Hello, myself Dr. Ranganatham, neurosurgeon, Astraprem Hospital, Amirpet, Hyderabad. Today we are going to discuss a very important issue regarding a life-saving medicine which was given for billions of Indians, and for some reason there is a controversy, not exactly controversy, it's in the news. I'm talking about Covishield vaccine. And the Covishield vaccine for the Indian population, there are 2.2 billions beyond the number have been given, and I call it as a Sanjeevani. And all the people who received the vaccination, COVID vaccination in India, Covishield covered around 90% of the total vaccination. There are other vaccines also, you know it, Covaxin, Corbevax, Sputnik, but all of them constitute around only 10%. And that is the scenario. And so Covishield was covering around 90% of the Indian population. And the first Covishield vaccine, which was produced in England, London, that was made by a very popular multinational company, not one country, but two nations, that is Swiss, Sweden, Switzerland, and England. And it was made by the combination of Oxford University. It's a very popular vaccine. And for India, the name has been changed to Covishield. The same vaccine that so many European countries also has been given, and so many lives have been saved. And imagine this vaccine, the first vaccine for Indians was given in 2021, January 16th. And I said first part of our discussion, more than 2.2 billions have received. 90% have received this COVID vaccine. Now the controversy has come, saying that there is a complication. Of course, not controversy. The AstraZeneca company, which is the producer of this vaccine, has agreed it, accepted that there is a complication. And the complication name is Thrombosis, Thrombocytopenia Syndrome. It's not a very happy complication, it's a dangerous complication, that too. It's a life-threatening complication as well. Now, I am going to discuss a few more aspects of this syndrome. In fact, no medicine, I repeat, no drug, no tablet, syrup, or vaccine is 100% safe, first of all. Now, the makers of the vaccine also, at the time when the vaccine was about to be introduced in India, even after giving the vaccine also, were repeatedly mentioned this point that small complications like headache, fever, body pains, weakness, swelling in the area where the vaccine is given in the shoulder, these are all possible. But the complication what I mentioned, this thrombosis, thrombocytopenia, was a very, very rare complication. Now, the Indian Council of Medical Research scientist, a very popular scientist, has said very clearly that if 10 lakhs people, please make a note, 10 lakhs people have received COVID vaccine, this complication is seen in only 6. That means a very small percentage. On the other hand, you can say out of 50,000 who received this vaccine, one person is likely to get this complication. That means it makes to around 0.002%. That's a minuscule percentage. Now, please think about the billions and billions of people who are saved and their dependents and the advantage for the economy for India. So, that time every country in the world have really seen the downtrend for the economy. But in India, we are seeing another upward trend because of the timely vaccine given to all our brethren and sisters of this country. Now, about this complication, though it's rare, it's a life-threatening complication. The complication, though known, actually in the Indian literature, there was a mention of this complication in two young men in 2022 in one of the journals. And both the young men had this complication where the veins of the brain, veins are the blood vessels which carry the impure blood. They were blocked, but luckily both were saved. Now they are back to their job. So those complications Not every time it's a life-threatening complication. It is a dangerous complication, but not everybody will die. One such person who survived this complication was the English person, Scott, who went to the court of law in England. And there was a compensation paid by the AstraZeneca company. They themselves were agreed, which amounts to around 1,000 crores in the Indian currency. That's a big money. So suddenly, and this news has come in the Telegraph, very popular paper of England, the Telegraph. So this was made a mention. And then for the last few days, there is a hue and cry about this complication. What is this complication? TTS, as I mentioned, thrombosis, thrombocytopenia syndrome. As the name itself indicates, there are two important events are happening in this particular complication. That is, one is thrombosis. What is thrombosis? Thrombosis is the blood vessels of the various parts of the body. If they are blocked or choked and the blood supply to the vessels is not proceeding freely, then the complication comes. And this we see very commonly in heart. Suppose the blood vessel to the heart is blocked, we get heart attack. If the blood vessel to the brain is blocked, it's called stroke. Same way like it, the blood vessels are in the leg, they are blocked, then they develop redness and swelling and all that. And suppose one of the blood vessels in the abdomen, in intestine, or in the spleen, or the kidney, or the adrenal, wherever it can be blocked, accordingly the problem will come. So this complication percentage also we talk about. And we talked about the Covishield. Now another important point to mention is that the Covishield vaccine complication will come not beyond 40 days. That means the complication should have come in 2021 itself or 2022, not in 2024. Now the people who have taken the vaccine Covishield, now getting worried about this possible complication, there is no rationale and there is no scientific basis. Please understand, because the complication is not mentioned to come beyond 40 days. And it's also said the first dose of Covishield, the highest incidence of this complication. By the second dose, the percentage will drop down drastically, almost half. And if the third dose, what is called the booster dose, the complication you can almost say negligible. Now that was the scenario as far as the dosage is concerned. The symptoms are that headache, severe headache, unexplained mainly, any difficulty in speech, blurring of the vision, dyspnea, swelling of the legs, abdominal pain, weakness of one half of the body. These are the various symptoms depending upon the organ which is affected, and accordingly the problem comes. There are investigations like mainly the blood investigations to see the platelet count. As I said, thrombosis is a blocking of the vessels, and thrombocytopenia. Thrombocytopenia is the percentage or the number of the platelets dropping down. Normally, as you know, it's all 2.5 lakhs to 3 lakhs. Suppose it comes down to say 25,000, 30,000. Below up to 1 lakh, it is not a problem. Anything drops down less than 50,000, it's a point of concern, because the platelets have a very great function created by the Almighty, that whenever there is a bleeding tendency or there is a bleeding by chance, there is a cut, there is an injury, the platelets role come into the fore, and the clotting mechanism is initiated and sustained by the platelets. So platelets have a very great role in everybody's human body. Now in this particular TTS syndrome, the platelets percentage or the number also drops down as a complication. So the blood test will be to see the platelet count. Normally, as I said, 2.5 to 3 liters, 3 lakhs. If this is low, it's a point of concern. And then, of course, the CT scan brain or MRI of the brain, and sometimes CT angiogram or MRI angiogram. Because the vessels are blocked, if there is a suspicion, the doctor, clinician thinks so, the status of the blood vessels supplying the brain and the heart need to be seen through the angiogram. And once these angiograms establish that there is a problem, suppose there is a problem called platelets are low, then we have to give platelet transfusion. And suppose the blood vessels are blocked, we have to give anticoagulants. And that is to dissolve this clot in the blood vessels, we have to give anticoagulants. And in this particular complication, they make a mention that usual anticoagulant like heparin should be avoided, and the anticoagulant of choice is oral anticoagulants by name warfarin sodium or acetylene, which is generally given in people who have the heart valve replacement or the blood vessels of the legs are blocked, called deep venous thrombosis. This is the ideal choice. Somebody had a fits, epilepsy, anti-epilepsy medicines have to be given. If there is a brain edema, that should be treated. If the patient is not breathing, then you have to put on a ventilator. And of course, the most important medicine they claim is immunoglobulins. Immunoglobulins attack the immune system which has happened in the body, and that is being taken care of. So steroids also, immunosuppression agents. So all these agents in the multiple specialties involvement with multiple doctors, consultants, and they will do the best possible treatment. Suppose there is a cardiology problem, the cardiologist attends, and the neurosurgery problem, the neurosurgeon. And to go back, that the first person who came to the court of law in England, Scott, had a brain clot that was operated by the neurosurgeon in England, and also the skull bone over the brain has to be removed to give what is called a relief of the pressure. And in the neurosurgery arena, we talk it as decompressive craniotomy. So that gives space to the brain. Of course, the bone can be kept back. So decompressive craniotomy was done in the person who was in the question, that is Mr. Scott, and he made a recovery. The only problem is, which is rightly so, that he didn't recover completely. He continues to have weakness of the body. He is not able to looking after the family. He is not able to going back to the work. So the court has agreed to that. Even the AstraZeneca company has agreed, and of course they paid the compensation. There are many, I think around 51 such cases in the court there. So how many of them will be succeed and able to convince the court that indeed it's because of the vaccine and all? We have to wait and see. In the Indian circumstances, I think as I told you 2 years back, we had a mention in the Indian literature, medical literature, about 2 patients, but both patients have recovered. But subsequently, we don't have any mention. So my plea and request to all the people who are lucky enough, I repeat the word, lucky enough, who received the Covishield vaccine, not to get worried. The complication is very, very low. As I said, it's 1 in 50,000 Covishield receiving people. And the problem, if at all, should have come immediately, that is within the 40 days. It's 100% unlikely that the complication can come now, after 3 years of receiving the vaccination. The fact that all of us are surviving in spite of the onslaught of the COVID virus in this second wave, and we are all lucky. We must pray God and thank the government that they have taken the initiative and they brought us out into this level. Thank you.